liposuction on the tummy and the thighs, but what about those pesky little places like under the chin, under the arm, or the dreaded back fat that you just can't seem to get rid of? That's exactly what microliposuction is for. And just to let you know, some of this may be a bit gross, okay? Which may or may not turn you on. I don't know where you're at. Here to tell us all about it is Dr. Thomas Loeb. Hello, Dr. Thomas Loeb. Tell us exactly what microliposuction, how is it different from regular lipo?
Well, microliposuction takes advantage of new technology where we have smaller cannulas. We've gone from cannulas that were about this size to smaller cannulas, so there's less bruising, there are finer holes in it, and the results are better. You can go after smaller areas.
So you stick this one in the chin like that?
This one, that's a chin one.
Okay, now let's start with Maggie. She's always been bothered by her chin.
Right.
Okay, tell us about Maggie's issue.
Well, Maggie's getting married in a few months and she's uncomfortable with this particular area. This is the zone that's going to have liposuction done. That's most of the fat there. She has some loose muscles as well. And this is the area that's marked, of course, before surgery. This is iodine being placed to sterilize the area. The liposuction is done through a very small incision.
She's out, right?
She's asleep. She's asleep. That's the anesthesiologist. And mostly there's fluid. This is the part you might not want to see. And the dressing's put on afterwards.
Okay, you know what? This was only, when did she have this done?
She only had it 12 days ago.
It's really not the... You have to wait a little bit longer for it to be perfect, but let's see what she looks like anyway.
Right.
Here's Maggie right here. Okay. This is just 2 weeks later.
It takes, what, about 5 weeks?
It depends on the zone. An area like this where there's quite a bit, it's going to take about 4 or 5 weeks to show that. But this is really at a very short time.
But you know, in regular lipo, if you have it sucked from your thighs, a lot of times it pops up in your boobs. Are her ears going to get huge?
Dr. Loeb, do you have a picture of somebody who's been about 5 weeks?
Sure. These are, and this brings up a good issue. This is somebody who's done about 5 weeks before, but the difference is she has some loose skin. And the reason we have this one is to show people when there's a lot of loose skin, you're going to get much better, but you're still going to have some loose skin. So liposuction has its limitations in this area. It depends on how loose the skin is.
So she should get a facelift.
This one needs a facelift in addition.
Oh, Lord, now she's got to get a facelift.
At least they want to get rid of that.
But they'll get a big advantage out of this anyway.
Margaret, best wishes for you and your
You
husband.
look good. Congratulations.
Next we have Daphne. Daphne's a triathlete who she said can never get rid of her knee fat.
Right.
Okay, I didn't even know there was such a thing. All right, tell us about that.
Well, I was excited about this one. She's got a good shape to her legs from all her athletics. She has localized fat really from this zone to this zone right there. So concentrate on that's the area. That's where we've got it marked there. These are what we call the high spots where most of the fat is. There's also a bone in there. Again, she's having anesthesia, so she's out for this. The area's got an iodine prep to it. The liposuction is done with small instruments through small holes. And yes, and here at the end of the procedure, I can see the shape that I made a better shape. And here she is, really 15 minutes later, smiling, and she's got wraps on her legs.
Can you do that to ankles too? Ankles. Some people
ankles
have fat
swell
ankles.
for a long time, but you can't do it with the ankles.
I heard that there tends to be a lot of bruising around the knee area when you do lipo.
Well, I
Is
think
that true?
Maggie's going to show you, Daphne's going to show you 12 days now afterwards, and there's not a lot of bruising. So I think that's...
But she's got, you know what though? I don't want the audience to be mistaken. She's got makeup on her legs.
No, but
I'm funny about that, Dr. Loeb. When I'm telling the audience something, they need to know that I'm telling the truth.
Right.
She's got makeup on her legs. So now, Daphne, how much bruising are we really talking about without the makeup? Because I can see bruises even through the makeup.
One leg's a little bit worse than others, but it really wasn't as bad. The whole thing wasn't as bad as I imagined. I went running 4 days afterwards. So
really?
Wow. Did it hurt?
So it may not hurt, but it does have
the
bruising.
running actually made it kind of, I don't know, it felt kind of better. I mean, I don't know if you know Dr. Loeb's office is right next to a swanky little lunch spot. I went out to lunch right afterwards. It's pretty easy.
Okay. All right. Thank you. You look great, I think.
Very good.
The bruising will go away, so.
Yeah, sure, there is bruising.
The next patient prefers to remain anonymous, but she was bothered by fatty arms.
Right. The area we're talking about is in this zone here, and then down the arms, which we'll show you with the next picture here. And this is more a classic area out here, and I tried to shape her in this zone as well. This is unusual, that zone, but this is typical, the outer arm.
Wow.
And again, this is done in an operating room with everything sterile. And there's
I'm sort of getting into it now.
this area, it's getting easier, isn't it?
Yeah.
Okay? So the fat here is a little thicker, look at that. So there's a little difference. So it's a little different.
That's kind of like a milkshake.
Right. So, and that's about it.
Okay, can we see her now?
Let's
This
see
is
her
2
now.
weeks later.
2 weeks only.
Wow.
Over here. You took it out over there. Does it hurt when I touch that? No.
Yeah, that's a little swollen there.
That looks good.
This
wasn't it
zone, Joy, this
painful?
bottom
That looks
zone.
really
That's
good.
yeah, all of that.
Look at that. This
And
is very
again,
hard to
now,
work out. You know?
Is there some bruising there? Not a lot, though, but
No,
there is
but
some.
that definitely, you don't see any bruising.
And this is only 12 days. Let's give her 3-4 weeks and we do better.
Okay.
But never any
Thank you.
pain.
No,
she's comfortable, but it wasn't
thank you so much. But make sure that you go to a certified plastic surgeon for
Right.
this, right? And our
Right.
thanks to Dr. Thomas Loeb. For more information on any of these procedures, log on to our website. We'll be right back. Certified.